Hello and welcome back to LTC Heroes Live by Experience Care. I'm in Louisville, Kentucky at the Kentucky Healthcare Association annual event, and I'm talking right now to the president, Betsy Johnson. Betsy, welcome to the program.
Thank you for having me. I'm very excited to be here.
Betsy, we've been in conversations for almost a year, and I was really excited to come here because I knew about your background. We were going to have you on the podcast about a year ago, and I think that you were going to be the first attorney turned president of association. So I want to dive into your background, and I'll start off by the question, what do you feel helped you in your background be a good president for Kentucky now?
Right. So I went to law school because I was raised by a Presbyterian minister and a school teacher, and they really believed in advocating for people who can't advocate for themselves. So I knew I wanted to do that. I went to law school in Philadelphia because they were known for their public interest side of, helping, again, people, that really need a strong voice to support them. So that's why I went to law school. I never thought I'd be in healthcare, but I joined state government, and I had I think, a very interesting career in state government for 16 years. I was a hearing officer. I heard certificate of need cases, Medicaid reimbursement appeals. I worked for the Department of Insurance, kind of went after the big bad insurance companies. And then I ended up as Medicaid commissioner, which was a tough job. I loved it. There's really, unfortunately, no good answers in Medicaid because you're always constrained by state budgets, which are always lacking money and funding. But I loved it. Then I decided to go into private practice. And private practice is similar to state government work because, again, you're advocating on behalf of your client. Your client's just different because now my opponent was the government, right? Because I'm representing physicians and insurance companies and so on and so forth. And then actually my predecessor, the association, Ruby Jo Labarsky, she was the president prior to me joining. I had represented her in private practice. I had met with her when I was Medicaid commissioner. We had engaged on opposite sides and on the same sides. She actually recommended me to take over when she retired. So I interviewed, and I've been here 8 years, and I love it. I love advocating for skilled nursing facilities and personal care and assisted living communities because I can tell you a lot of people and policymakers and government, both federal and state, really don't understand the model.
I'm glad you wrapped it up with that because I had the pleasure of interviewing Mark Parkinson from ACA about 8 weeks ago at the Nebraska convention. I told him, I said, what's it like advocating for long-term care at DC level? And he said, well, it's hard because no one understands it, right, and it's easy because no one understands it.
That's right. And I have all the respect in the world for Mark, and what a great background he has as an attorney, owner, legislator, governor. So yes, and it's true because, and I'll give you one example. So one time we were meeting with people that were running for a House of Representatives here in Kentucky. They were candidates, and we were interviewing them, a program that the chamber held. And they put me in a room with the people who also advocate for bourbon here in Kentucky. Mm-hmm. And I would tell you when they were like, well, we represent bourbon. I mean, their eyes would light up because, everybody loves bourbon in Kentucky. It's an economic driver. People like to drink it. It brings tourism to Kentucky. And then I would start speaking, and their eyes would glaze over. Like they had no idea what I was talking about when I was talking about Medicaid reimbursement and certificate of need laws. And it's really heavy stuff. And then you're also talking about a population that we don't want to think about all the time, people at the end of their life, or people who have to go get some real rehab services. And I think people just don't want to deal with it. And we have to find those champions in our state house and Senate that do care, and we have those, but it was hard. And Mark does a great job on the federal level, and I feel like our association does a great job on the state level.
Nothing against the bourbon advocacy leaders, but working and leading members who have an impact on American seniors, which you do, must be very rewarding. Obviously, you're not on the front lines, changing changing beds
Yeah.
and things like that, but you're working with the people who are taking care of that.
Right.
What how does that, I guess my question is an emotional, how does that translate up, trickle up to you, and you see it, you feel it in your heart, or the way you see the world?
Right. And, I've had the privilege of traveling our state and visiting a lot of our members. I haven't been in every building, but I've tried to be in at least one in every county. And then my mom and dad both had those services at the end of their life. And so it is personal to me. And I believe, again, I think people don't want to think about it, but when I'm advocating for increased Medicaid reimbursement, when I'm advocating for common sense regulatory reform, I'm advocating for that nurse aide who is coming to work every single day and caring for people who can't care for themselves anymore. I mean, there's a reason why people are in skilled nursing facilities. It's because they need assistance with walking or they need assistance with being fed. And it is such important work. When my parents were in skilled nursing facilities, I literally would hug those caregivers because my brothers and I have jobs. They couldn't have lived safely at home. And the fact that a lot of the naysayers are like, oh, they don't need any more money. What that money, the reimbursement, the Medicaid, all of that goes to care for to provide quality care for those seniors. And who else should we care for? I mean, these people have lived their lives and been our parents, our grandparents, and what we do is so important. And we always try to get our message out, and hopefully we do it effectively.
I, we're formally on day 2 of the convention, but people start to trickle into Louisville early, especially because we had a long weekend. What have your conversations been with members, starting on Sunday, starting on Monday, formally yesterday? What are people concerned about? What are they asking you to talk to local governors and then also advocate at the national level?
Our two biggest issues are workforce shortages and, again, going back to funding. And I know people don't want to talk about money. I know they think, oh, that's just, it feels like all you do is asking for money, your handout. But what happens? Okay, so what's happened during the pandemic? Or actually pre-pandemic, we were having workforce shortages. And again, this is difficult work that nobody really wants to think about or talk about. And we're competing against, large corporations like Amazon here in Kentucky and trying to get people to come work for us. We were having workforce shortages prior to the pandemic. It really got bad during the pandemic. People quit. I mean, they were scared. They decided that they could do something else and not have the stress of caring for people who were potentially going to get COVID. And so we're having those shortages. So we are in talks with people in Frankfurt about what we can do to increase the pipeline to people in long-term care. And I think if you're talking to anybody here, they have a unique story because you can actually join a skilled nursing facility right out of high school because you can get certified as a nurse aide, and it truly is a career path. I mean, I have people on our board of directors who start out as nurse aides and now are in corporate compliance. And a lot of our facilities will pay for people to go back to school, and our association also provides scholarships. So we have looked at every option, every availability. We're partnering with our Kentucky Chamber. Again, we work with legislators to deal with that workforce shortages. And additionally, that's tied to reimbursement. So and this is kind of getting into the weeds, but I think people who listen to your podcast like this kind of stuff. But our Medicaid rate hasn't been rebased since 2008. I mean, 2008. That's when I started as Medicaid commissioner, and I've had this is my second job since doing that one. And so we are in talks with our Medicaid agency about rebasing our rates because during COVID, we did get additional funding, a $29 per day Medicaid rate add-on. But that's not enough when you're dealing with trying to be competitive for those workers, when you're looking at inflation, supply chain issues, all of that. So I would boil down, if you talk to anybody around here, they would say workforce shortages and additional funding are the two important things.
I'm glad that you mentioned. I'm glad that you mentioned kind of from bottom up, from CNA up and moving all the way up, because the long-term care does offer that. Yesterday, I had the privilege to interview Penny Upton, and
Oh yeah,
she
she's
went down the
wonderful.
exact same path, and now all three daughters are CNAs as
Oh, I
well.
did not know
Yeah,
that.
that's a
Yeah.
really cool story. I wanted to ask, and feel free to say pass because maybe you haven't had enough time to interact and hear. But have you heard any creative ways of long-term care organizations trying to help out with the staffing shortage while they wait for reimbursement rates and pay rates to improve? I've heard of, hey, let's go get nurses in the Philippines. I've heard of people, let's recruit people from the age of 16 to get them volunteering so they realize that this is rewarding.
Yeah.
Have you heard of anything unique to kind of lower that cost of agency?
Oh, right, and that's important. We need to reduce that cost and the usage. I mean, and I'm just going to get off on a tangent. Agency is a necessary. We used them before the pandemic, but really, I think everyone would agree that having somebody employed, and that is their place of employment, that they're not traveling around, it's good for the seniors, and it's also good for the culture of the workplace. So again, agencies are necessary, but we do want to ensure people are employed and are loyal and committed to the facility that they're working in. um, yeah, we've heard of all kinds of interesting things. I think what our association has done is we've been really connected to uh, high schools and universities. We're going to have some University of Kentucky students here today, people who are getting degrees in healthcare management. But it's been interesting. I've attended a couple of virtual meetings where they've met with some of our leaders in our association, not staff, but people who actually work in long-term care. And I think they've learned so much from them, and it's opened their eyes to, again, kind of going back to the point about what Mark Parkinson says is, because nobody understands what we do, it makes it hard, but it also makes it easy. I think these students have seen that there's so many opportunities in long-term care, and there's such a need that that this is where they could really grow, and the potentials are endless. I mean, again, start out as a nurse aide, work your way up to CEO, and everything from activities director to dietary, and there's some wonderful people working in our facilities around Kentucky who are maintenance directors who do creative things every single day. So I mean, there's such again an opportunity to come into a facility and work with great people, but also care for wonderful people as well.
Betsy, as we start to wrap up, I want to ask you to take off your humble hat and share with me something that you feel that you've done particularly really well in the last year or 2 years or 3 years. And it could be as simple as, I hired someone who makes the association better, or we've grown membership, or we've brought in some key members, or we have a new board that's really, really doing well. Anything that you're really proud of that maybe hasn't gotten the press that it deserves, but we'd like to highlight it for your members.
I mean, you mentioned hiring people. I have a fantastic team. I really do. I'm thinking about all of them, but we're small. There's only 9 of us, and we represent the entire state, and hundreds and hundreds of providers and individuals too, because our membership is based on facilities, but there are people behind that, right? There's individuals all over. So my team, and I'm not going to name names because I'll forget somebody, but the it's all around advocacy and education, and just trying to really have people understand what our members do. But we do a great job, I think, with social media. We do a great job with communicating with our legislators, and it's a team effort. I mean, we have, of course, somebody that does communications and marketing, but we have people who understand the subject matter, whether that be Medicaid reimbursement or the regulatory issues. I just recently hired somebody who retired from state government after 28 years. She and I work together at Medicaid. I mean, she understands how government works, and that's just going to help our membership even more because we'll be more effective in Frankfurt. So I think for me, the team that we have, and that I've built in the past. You don't want to be humble, but the team that I've assembled over the past 8 years is something I'm very proud of.
I think my last question, or my last serious question, because then I'm going to talk about the DJ that we have going on. It's really good. It's the best DJ so far. My last serious question for you is, when you are running into a challenge or something that you don't fully understand, or you don't understand the direction something's going in DC or local politics, who do you call? Do you call another president from, are you close to, the president in Missouri, and you call them, and you're like, hey, let's jump on a phone and let's work this out together, or put our teams together? Who helps you? Who's your peers?
Right. So you mentioned Missouri. Nikki, I don't know if you've met Nikki.
I have met Nikki.
She is a great friend of mine. I text her, I call her. In the state executive world, we we're a very close-knit group of people, but you end up really being close to the people that you go through new state executive training with. American Healthcare Association puts that on. Nikki was in my class, Rachel from Arkansas, Kevin from Texas, Robin Dale from Washington State. He's just retired, but we can text each other. We have a community email system. They are wonderful. So if I have a question, or I feel like we should go in a certain direction, I'll just say, anybody doing this? And people will respond. It is, I would tell you, that has been another great thing about this job, is the people I've met across the country, both my counterparts in other states, but people at American Healthcare Association. I really wish the membership could really see the dedication and the people working behind the scenes to make sure that they have everything they need to care for our elders.
I can vouch for what you said as being a tight-knit team. I'd give a shout-out to Michelle Walters from Missouri, because every single time I'm thinking about taking the podcast to a new convention, people knock on her door and like, hey, would this be helpful? And I know that you guys are tight-knit behind the emails, behind the phone calls. Lastly, did want to shout out, I love the organization. Angela's done a great job. Emily's done a great job, especially with the DJ. So we have kind of 2 days left. What are you most excited about? Who do you want to go up and hug that you haven't seen yet, or a specific keynote speaker that you're excited?
Well, yeah, I haven't seen everybody. And so, again, we have 2 days. Tomorrow night, we'll be having our banquet. And that's when we celebrate our long-term care workers. And that's when I'm like, oh, there's so-and-so, because I get busy and I'm pulled in different directions. And I can't even describe the energy in the room. And we celebrate people, again, nurse aides, but then also we give out a Ira Wallace Award. It's our biggest award. And it's a secret.
It's a surprise.
Yeah, and I've actually sat beside the person who's going to get it. I'm like, who are they talking about? And that is so exciting to me. Have you met Mike Wiley?
I have not.
Okay, well, he was HCA's chair of the Board of Governors a few years ago. And he came to our banquet one year. He goes, "This is the best thing ever," and it is. It's the energy in the room. My first banquet I attended, which was 9 years ago, I walked down. They're like, "Oh, great show, great show." I'm like, "It was," and they're like, "You didn't have anything to do with it." I'm like, "I had nothing to do with it, because it's Angela, it's Emily, it's the team that puts it together. Everything from the music to the lighting to what I say, and so that's what I'm most looking forward to."
That's really cool that you got to sit next to the surprise recipient tomorrow night. I interviewed the administrator of the year in Florida on the podcast about 6 months ago, Lonnie, and he said that when he was awarded, he's like, they're described what? It sounds like they're talking about me. And then he realized it, and then he got emotional. He got up on stage and forgot to thank his wife. He goes, I was so embarrassed. He goes, I was so nervous.
Yeah.
So those are cool moments.
Yeah.
Thank you for sharing.
Yeah.
Betsy, thank you for joining LTC Heroes. Thank you for joining, inviting us to Kentucky. I wish your members the best, and thank you for sharing all your story. Your
well,
background.
thank you for being here. Appreciate it.